Hello everyone. Today we'll discuss about cervical intraepithelial neoplasia. First, we should know that there are two epithelial linings. Vagina and ectocervix is lined by multiple squamous layered epithelium, and endocervix is lined by single layered columnar epithelium. Now, what is this squamo-columnar junction? It is the junction between these two layers. And one thing you should know about is transformation zone, which has metaplastic and maturing squamous epithelial cells. You should remember that most cervical cancers arises here. Now, there are three types of CIN. CIN 1 is lower 1/3 is involved and we call it LCIL. And CIN 2 is lower 2/3 is involved and CIN 3 is whole thickness is involved. So you should know about these. Then remember that in CIN 1, transformation to cancer occurs only in 1% of cases. Only 1%. In CIN 2, transformation occurs to cancer in 1.5% of cases, and CIN 3, 12% of cases progresses to cancer. Then we'll next discuss about what are the risk factors for getting cervical cancer. So HPV, human papilloma virus infection, young age at coitus, low socioeconomic status, multiple sexual partners, sexually transmitted diseases, immunosuppression like HIV, and smoking, and using combined oral contraceptive pills and malnutrition are all the risk factors associated with CIN. Now, you should know about the vaccines. We have three vaccines most commonly used. First is Cervarix, which contains protection against HPV 16 and 18 strain. Then we have Gardasil. It is a quadrivalent vaccine against HPV 6, 11, 16, 18. Then you have Gardasil 9. It protects against 9 HPV strains as mentioned, and it increases protection against cervical cancer by 80%. It is most expensive and it has been recently made available in India. Now, what is the dosing schedule? Like, it is basically for age groups of 9 to 45 years, and less than 15 years, you give 2 doses that are 6 months apart, and more than 15 years, you have to give 3 doses at 0, 1 month and 6 months. Then what are the cervical screening methods for cancer screening? First is pap smear. So what ACOG guideline states that it should be started at 21 years of age, and it has to be done every 3 years, 3 yearly till 30 years. And when the person has achieved 30 to 65 years, we can do 3 yearly pap testing or 5 yearly HPV based testing. Then in immunocompromised patients like HIV or other conditions, you have to screen them annually. Then we can stop pap testing at 65 years when 3 consecutive negative pap results are there, or 2 consecutive negative HPV based tests in the past 10 years. Then if a person has been detected with CIN 2, 3 or adenocarcinoma in situ or cancer, then till 20 years you have to screen that person after treatment. Then what are the prerequisites of pap? It has to be done post-menstrually. Abstinence should be there for 48 hours, and associated if the female is having any cervicitis or vaginitis should be treated. What is the procedure? We use IR spatula. It is a frequently asked question, and it is rotated 360 degrees, and it is fixed in 95% ethyl alcohol. It is commonly asked in Viva. Remember, it is not formalin, it is ethyl alcohol. Then thanks for watching. In next video, we'll discuss about what are liquid based cytologies and what is visual inspection screening of cervix, as Ministry of Health and Family Welfare in India suggests that 5 yearly we can do VIA, visual inspection of cervix with acetic acid. So we'll discuss that in next video. Thank you.